This discussion is about the evidence-based practice pertaining to number one, the clinical issue and the clinical inquiry. Another discussion will be focused on how to ask for a searchable or answerable questions. And the third topic will include the steps of evidence-based practice. And the fourth would be the importance of PICO questions. Now let's recall as to what are the aim in healthcare. Evidence-based practice, as you may notice, has four or a quadruple aim. And these are number one, to enhance the healthcare quality. Now, when we speak of enhancing the healthcare quality, that means the hospital per se or the hospital itself wants to improve the services that they offer. They are geared towards what we call the excellence of service. Now, another aim of the healthcare is to improve the patient outcomes. As you may see, improvement will talk about the treatment and recovery of the patient as to how long will he be confined and how long will he be discharged. And aside from excellence in healthcare quality and the patient outcome, of course, there will be a reduction in the cost of hospitalization. This is pertinent to the hospital bill, and evidence-based practice primarily will empower the clinicians. Now, when we speak of clinicians, these are the medical professionals who works in the hospital, notwithstanding the doctor, the nurses, and some other technical support system. Now, let's talk about the key to a successful patient care. Now, in order for the clinicians to become what we may call as a successful practitioner, they must be able to articulate, be very articulate and skillful in formulating a question. That means if you are a nurse or even a doctor, you must be able to have a good assessment skill. And that will require a good communication skill. And what you are looking for is you want to clarify a clinical issue. Now, when we speak of a clinical issue, this pertains to the reason why the patient is in the hospital. Basically, we may ask the reason as to what would be the chief complaint why the patient is submitting himself to a medical examination. And when we seek for a clinical issue, okay, the very first step to do is getting the right information. That's why for nurses, we do the assessment of the health assessment. More than that, the history taking. That is, we want to know the real clinical issue and that we want to ask for a searchable and answerable questions. Now, it is through this clinical inquiry that we gather the data, we collect all the information, we classify the data, and we analyze the data. That means we appraise the data as well, and we find the choice of action. Now, as you may see, the most important thing here in EBP or evidence-based practice is that when there is a clinical issue, this must be sought properly. And this can only be gathered through the articulate and skillful clinicians, we may say talent. Clinical inquiry is necessary by gathering the data. And then what will you do if the data has already been gathered? Then you have to formulate a clinical issue. Now, in formulating the clinical issue, the first step would be to find the right information.
Let's talk about the steps of evidence-based practice. As we may remember, evidence-based practice is geared towards a quadruple aim, and that can be achieved by following the order of steps of evidence-based practice. And mentioned here are 5 steps, namely 1, to ask, 2, to access, 3, to appraise, 4, to apply, and 5, to assess. Now, there's one thing that you may notice about all of these steps of EBP. There's something that will guide your memory and will make you easily remember all those steps. This all starts with letter A. Ask, access, appraise, apply, and assess. That's easy for you to remember. And there are only 5 steps that are mentioned here. And in order to come up with a change in practice that is backed up and supported by evidence, we have to go through the order on how these steps are being mentioned. Let's take a look at that. When we ask, that is from a clinical inquiry, remember that the clinician will ask a question to the patient, and that could be accomplished through a clinical inquiry, that is by doing a physical or a history taking or any other form of assessment to be done by a clinician. And the most important factor that you have to consider is that when you ask, you formulate a question. And that kind of question is what we call the P-code question. P-code question. We will talk about that later in our discussion. And then after asking a question, then that's the time you have to access. Access means to search, meaning you are going to look for the evidence because you want to support your claim after formulating a clinical question. And that you have to look into the databases. And that would be another discussion in the coming days. And then, of course, you have to appraise. Now, when we appraise the evidence that we have secured, that means we will decide whether the research or the evidences that we have gathered is worth our attention or worth our time. Is it relevant to the topic that we want to come up with in evidence-based practice? And then once you have come up with a decision, then that's the time you have to apply the changes that you have decided on based on the evidence that you have got. And from time to time, whenever you are already practicing the best practice, then you have to assess whether that practice is still viable or still doing what you have intended to. Okay, now this is the first description of the steps of evidence-based practice. But you see, it goes in cycle, and this must be followed in order for you to come up with a sound judgment and decision whether to change or not the practice based on evidence. And then here you may notice that there are an additional steps from the 5 that we have learned from Menlik and Overholt. It has been mentioned there that before you start asking or formulating a clinical question, first you have to cultivate the spirit of inquiry within the EBP. That means the people who are involved in evidence-based practice must be stimulated, or they must be given an inspiration, or they must know the very reason why do they have to change their practice and apply the evidence-based practice. And if you may notice here, there is this 6th step. From what we have learned in the first discussion, there are only 5 steps, and it ended with assessment. But in here, you may notice that dissemination is important once the practice has been a successful one. You have to disseminate and let the whole world know that the practice that you are doing now, that the practice that has changed your old ways, is very effective and efficient. Okay, we'll continue with the next slide. At this point, we will be talking about the first step of evidence-based practice, which is to ask a question. And in asking a question or arriving at a clinical question, we have to learn that there are types of questions, such as 1, the background question, and the other one, the foreground question. Now, these two types of questions will be different, if you may notice. Speaking of a background question, background is synonymous with the word foundation, meaning you are going to ask a deeper question here. The questions that are being composed of general information, that is in order for you to deal with the clinical issue. And a background question is broader in scope compared with that of the foreground question. That means you have to know the details and the general information about the patient, the demographic and the biographic details of what is the patient all about. And generally, there are components, two components of the background question. One is the starting place of the question, and the other one is the outcome of interest. Now, first, a background question will tell us more on the 5 W's, the why, the what, the where, the when, and the how. That's the how is different from the 5. More than that, in the background question, there will still be questions about the clinical diagnosis. And I will give you an example. Now, take a look at this example, and we will see how will it change when we talk about foreground question. The first example is, how does the drug acetaminophen work to affect the fever? Now, the question is very basic. We're talking about acetaminophen and its effect towards the fever. That's the first question. Remember this question because we will try to compare this with the foreground question. And the second question tells us about how does the hemodynamics differ with positioning. Okay, this question tells us when you are lying flat or when you are standing, is there a difference in hemodynamics? Is there a change in blood pressure or something? Now, this is all about the background question. Now, let's take a look at the foreground question. In the foreground question, this foreground question deals with specific knowledge, or the focus is on specific knowledge and scientific in approach. Now, these questions are all focused on the diagnosis, the treatment, and the prognosis. Okay? Now you see the difference between the background question and the foreground question. Let's take a closer look on how we format a foreground question, or the formatting of a foreground question. We know very well from the previous slide that a foreground question is a question that relates with treatment, with intervention, and that this is more complicated. And let's try to look into the domains of the foreground questions. As you may see, there are 5 of the domains of foreground question: intervention, prognosis, diagnosis, etiology, and the meaning question. When we create a clinical question, we have to know what kind of a question are we formulating. We have to be very scientific as to classifying the kind of questions that we are making. And let's take a closer look now. These are the domains. In the first domain, the intervention question, I want you to take note that when I say intervention, it also pertains to a treatment. A treatment that we will be talking about when you are asking question, you ask about the treatment pertaining to a particular pathology. Let's talk about the COVID-19, and we want to formulate a question about COVID-19. What would be the question that you can formulate with respect to intervention or the treatment? We know very well that COVID-19 can be experimentally treated by a medication called as the hydrochloroquine. Or this can be treated experimentally by remdesivir. And some can say that it can be dexamethasone. Now, that kind of question will tell us that intervention question is about how is the disease being treated and how do we deal on that. Now, the next question is about prognosis or the prediction. Now, when I say prognosis, we are after the outcome, after the treatment. What will happen to the patient after being affected by the COVID. Will the patient recover easily or without complication? Or the patient will recover with a drastic complication? Now, in the diagnosis question, when I say diagnosis, that means this is the test. When you want to create a question related to diagnosis, you are looking into what are the tests. And in our example of COVID-19, we know very well that the diagnosis for COVID-19 would be a throat swab and or now the saliva test. So when you formulate a question, you will ask a diagnosis question. That's kind of question you are going to create. And you may notice in the later stage of the COVID-19, the test would be either to subject the patient to an X-ray test exam or a CT scan. You will try to compare that in diagnosis question. And in etiology question, etiology means that is the beginning or the causative factor. In etiology question, let us say I want to formulate an etiology question with respect to COVID. Is a COVID that you are suffering from now being caused by the coronavirus that has been first discovered? Or is it the new variant of coronavirus, the B.1.1.7? And that would be a question about etiology that you might want to ask to your patient. And finally, the meaning question. Meaning question talks about how is the experience of the patient. In our typical example, COVID-19, probably my question would be, is having a COVID-19 and having recovered from it, what kind of experience is that? Is that a life-changing experience, or this is just a dreadful or uh, a very devastating experience? So these are all the kind of questions that we will format or we will create based on the different domains. And you should be aware that when you ask question, you should be able to classify what domain is that and what do you really want to ask about the patient, and how will you classify that into a different domain. And that is still what we call the foreground question.
That's all, folks. This has been your Nurse Radiologico Guru saying thank you for watching and enjoy studying.